Hi, Dr. Franchelle Hamilton. Welcome back to Your Health Transformed. I am your host, and I'm excited to talk to our guest today, Catie Harris, founder of Nurse Preneur. I love that name. I was telling her ahead of time about I love that. And we are going to talk about healthcare in general, like where it's at, nurse burnout. I mean, and she knows it's not just nurses, it's all of healthcare, and I was on my soapbox, Catie, earlier today, just talking about insurances and reimbursements to the hospitals. And so now the hospitals are making cuts in nurse pay and physician pay a couple weeks ago. This is recent. And and we're at the busiest time of our year. You know what I'm saying? Because it's like flu season and viral season, everybody's sick. And so it's very hard, you know what I'm saying, when you're very busy and you're short staffed. And this is one of the things that leads to burnout. So welcome to the show. That's a very long intro because I can sit on my soapbox and talk about this all the time, but I'd love to hear where your background and then how did you get into this? And now you're helping other nurses who are experiencing burnout. So
thank you so much for having me on the show. And, I definitely went through the burnout period, though I would say I didn't recognize it at the time as burnout. So I remember, I've been in the hospital for like 20 years. I always worked neurosurgery. I was a neurosurgery nurse and then nurse practitioner. I did everything with the surgeons. It was a lot of fun. I enjoyed it. But then it got to a point where I don't know, it's like I just stopped growing. It's not that there was not anything else to learn, but where I was, my position required me to do the same things over and over and over and over again. And it catches up with you, especially because I pulled a lot of long hours and there's always a fire to put out. And that was exciting when I was 20 and 30. And then, late 30s and 40s, it gets really irritating. Yeah. And it's the same thing over and over and over again. And there's no end to the problems. It didn't feel like, anyway, I don't want to speak for everybody's hospital or even my own for that matter, but it didn't feel like anybody was really in charge or taking charge of it. And I'm that type of person that will just own the problem. Like that was one of the things that I think the surgeons liked about me because they'd be like, oh, hey, what's it? And that was my thing. But it was, I don't know, it got tiresome. And I used to walk into the hospital and the second I walked in, I was like, I got irritable and angry and I'd sit down and people would say, hey, Catie, and I'm like, what do you want? It was just like nasty. And I remember this one time we were on rounds and I had the charts and this is first thing in the morning after my coffee, everything. And I'm just like slamming them down. And one of the residents is like, what is wrong with you? And I'm like, I don't know. I don't know what's wrong with me. And it took a lot of soul searching. It wasn't like I had an epiphany one day one. It took years for me to figure out what was wrong.
Yeah, and that was going to be my next question, but you've kind of outlined some of the signs. So like, what are the signs of burnout? And it's just when you walk in, and I've gone through it too. So I understand where you walk in and you're no longer excited. You almost like dreading, you know what I'm saying? It's like you're at home and you're doing and you're happy. And then you walk into your place of work and it's like a dread, mood changes that most of the time it's other people recognizing them before you recognize them. And just unhappy, and then if you continue down that road, depression can kick in, like all these different things. So it's actually not healthy to be in an environment where you're no longer happy. You no longer feel fulfilled, so to speak. You know what I'm saying? And so
exactly. And I just didn't even like myself at that point. It's just like,
because you're like, I'm not even this type of person. And it's almost like you're an out of body experience. This person is acting this way. And it's like you up here, like, who is that and why? Trying to figure that out. So that's where you were saying all the soul searching, but that's exactly the signs.
Yeah. And I'll tell you, though, the one thing that really kind of set the whole thing into motion was I'm just a really laid back, quiet, introverted, I've come out more as I've done more podcasts and started my business and that kind of stuff. But give me a cave and I can sit there for weeks, right? I just don't get upset. I generally don't get upset. But after years of just kind of pushing things down and just the anger and the frustration and the irritation and all that, I ended up getting into a fight with one of my attending neurosurgeons, and it just blew out of proportion. It was really stupid. It was like the dumbest thing. I can't even remember. It was something over a heparin drip or something. It got blown out of proportion. I lost it, was like slurring off profanities left and right, and they sent me home and suspended. And I had to go to anger management classes and all this kind of stuff. And it was those 3 days where I just kind of sat around and thought, like, okay,
yeah, this is not even me. Like, this is not even.
I'm like, I have a PhD, I've got an MBA, I've got 4 master's.
You're like, what just happened?
Yeah, and I'm in anger management classes, and I'm like the most laid back person on earth. Like,
yep. That's a sign.
The universe is like, wake
correct. Up. Yeah. So once you kind of had that, soul searching event, like, what did you do next? Like, how did you get out of that? How do people in situations get out of this?
Well, so, I wish I had a really good story for this, but what I ended up doing was leaving that hospital and going to the hospital, thinking that it was the hospital, but it's not the hospital. So I went to the next place and actually went with one of my residents who had graduated, and they wanted him to open a cerebrovascular center in Atlantic City. So I went with him down there, and it was fun for like the first 6 months. And it was just the two of us, and we were both on call 24/7. And it was a lot of fun, and then it wasn't. And those same feelings started coming back, just the burnout, the running around, and it's never done. There's always a fear every single day. And it was just getting really old.
And you felt that. You recognized it this time.
I did recognize it this time. And that's when I was like, I need to take a change. At that point, I had gone into academics, and, I went into academics, took my first job as assistant professor, sat down at this desk, and I'm like, all right, well, there's no fires. This is boring as hell. So I'm like, there has to be something else to do. And in my boredom, I started a business, and that's where I, started meeting a bunch of people. And that's what really pulled me out of everything, out of the burnout, was,
helping others almost get through their stuff and recognizing their stuff. That's great. Well, and that makes sense, honestly, because as a nurse, and a physician, healthcare worker, like, you go into it wanting help. Like, that's your purpose, wanting to help people. And so because you're no longer helping patients, you're still able to still help other people. And so it's interesting how you kind of got out of that and then found yourself doing very similar, but just in a different field. So I guess, like, what are some of the things, how do you help other people kind of go back to that purpose? Because I feel like your purpose, kind of like your big purpose, is still the same, help others, right? And so how do you help other nurses, like, kind of make that shift when they're burnt out from typically hospital or other like patient care type of situations, and they want to make a shift, but they still want to help?
Yes. So I would say the first thing on that trajectory was the awareness of other people like me, that I wasn't like a complete anomaly. And I wanted to go into business. And I always had that kind of like fire in me, or that streak. Even when I was like 6 years old, I went door to door selling like stationery or something, which still amazes me that my parents let me do that. But
times have changed.
Exactly. But I wanted to know what I could do as a nurse, and it wasn't clear to me, and it didn't seem to me that there were any other nurses in business, which is like a stupid, naive thing to say when I think about it now. But my first move was to start finding nurses that had businesses, figure out what business they had and how they did it. I had worked for Walmart for several years as a in their corporate headquarters as a talent acquisition manager. And in that role, I met high-level nurses in different organizations. And one woman in particular was Diana Mason. And Diana Mason, she does radio. She does these radio. She has a radio show. And I was I remember grilling her. I'm like, how do you just get on radio? Like, this was
all these questions so foreign to people who work in, you know what I'm saying, in a hospital. Like, right. Or, how does somebody make money off a blog? Like, all these questions, they were so like out there for me. And I ended up interviewing her, and that became ultimately like my first podcast.
episode, and then just kept that going. Like this guy, Dan, he had a CPR business. Well, how did you do that? Like, what did you do first? And what were the challenges and that kind of stuff. So that's what I've collected about 200 of those stories at this point, of nurses and how they did things. And that was really, really important. But out of those podcast episodes, I met nurses who were like, I'd really like to put this into a course. And I was like, oh, well, I have this audience, because I had a Facebook group at the time of about 10, 15,000 nurses that were interested in business, and we're just having conversations. And I'm like, well, I'll sell you, if you put it in a course, I'll sell it to my audience. And that's kind of how that business model came together.
Oh, wow. That's great. That's great. And so in making that shift, like, how do you kind of help nurses to, what is it when you're talking to the people that switch from one healthcare, like patient care, to something else? Are they still like helping, or some of them like completely going different direction?
Yeah, no, it depends. We certainly have like business in a box type models, and then there's other nurses that want to do consulting or leadership. But a lot of them, they'll come with a like a problem that they want to solve, and either they don't have permission to solve it in their hospital system, or the hospital system keeps like saying no.
Yeah,
dismissing their ideas. The other issue with nurses is that, we're always given orders to do anything, right? So when you come out, you start looking around like, who's going to tell me that I can do this? I need permission or something like that. There's that kind of underlying vibe that's there. And I find it a lot when I'm talking to the nurses, and they'll say, I'm not even sure if I'm allowed to do this. I think a lot of entrepreneurs go through that, but it's definitely a living, breathing thing that exists in our culture. So
yeah, I can see that. And so essentially, whenever they come see you, it's identifying whatever this problem is, and then helping them work out how to turn that into their own, having them help create kind of a solution and going that route.
Right. Yeah. So I'll say, like, I get a lot of nurses that want to help their cancer patients, and they see them, and, there's the system that's in place. They don't think it's enough. So I have one nurse practitioner in particular who was like, I feel bad for the breast cancer patients that go into remission, and then, all the resources are taken away from them. Like, and they're left alone. And that's like the scariest time. Not that I can't speak because I don't have
correct.
Cancer patients, but it's one of the scariest times is when they go into remission and everything's kind of pulled away from them. So she wanted to create a resource to help empower those women and, give them an opportunity to do stuff for themselves. So she has, detox program. She's a nurse practitioner. She's worked in oncology for 20 years. And she helps them that way. So that's one of the ways. And it was just a matter of like talking it through with her.
Yeah. Okay. And so now she's no longer in the hospital. That's what she does now.
Right.
And oftentimes, so when they make this transition, and this may be like a duh question, but do you see that they feel more fulfilled? Do you know what I'm saying? When they kind of make this, and what happens when they can't turn it into a business and they need income?
Yeah, no, I always encourage everybody to hold on to their jobs.
Yeah, okay, yeah.
Because at first, I would say your first 1 to 3 years are your hardest, and they're going to be your most expensive. But I go back and forth with this, because at the same time, having a steady, reliable paycheck is like crack. It's you can't get enough of it, and you're afraid to give it up. But it's like it is hard to let go of that. But I would want to see income coming in, even if you have to take a step down in your pay and give up some things. It would be worth it, but only if there's steady, consistent, predictable income coming into your business. I say that with a grain of salt, because you never know with a business, but you'll get to a point where you're comfortable enough. But you'll also get to a point where you're burning the candle at both ends, and you cannot work. I mean, most nurses have 3 or 4 jobs.
Yeah.
So the thing I have them do is give up job number 3 and 4 so that we can actually put the business together and then work it that way.
Yeah, no, I agree. I mean, I'm still in it, and I go to work now. I do a lot of emergency medicine and acute care surgery, and it's like I say I come home, I'm like, all of my nurses have like 2 and 3 jobs. You know what I'm saying? I'm just like, part of the economy. I just feel so bad for them because they're working, you know what I'm saying, so much around the clock. So
well, some of them are work junkies too. Like they
yeah,
yeah.
yeah, exactly. They just like working. And so
Yeah, no, it's really hard. I mean, I really, to be honest, I think it's just poor management. I think a lot of this goes back to the fact that the nurse is tied to the cost of the bed in the hospital system. So they're seen as a commodity that can be, kind of like furloughed or hired or replaced very easily. So a lot of it's, I feel like we've lost the culture. I'll say when I was a nurse working on the unit, we got paid at the 50th percentile for our area, and down the street was the University of Penn, and they were paid at 80th percentile. And none of us wanted to leave because we had this kind of culture family. We took care of each other. Our management system took care of us, and it really worked. And then we got taken over by another hospital system, and that all went to crap. Like they didn't care. They started firing people, replace. There's like this obsession with recruiting nurses, but they don't spend any money on retaining.
Yeah. No, I agree. I'm currently still in a hospital system as I transition and it's 100% like that. Like it's 100%. Like the new nurses, they'll get like all day, but then, a lot of the more seasoned ones. And as a physician, that's frustrating. It's frustrating to us because we're like, I mean, nothing against the new ones. We want the seasoned ones that we've been working with for, you know what I'm saying, a long time. And they, had the same pay for like the past 10 years or something ridiculous, you know what I'm saying? And it's just,
we had new nurses coming in making more than the nurses that
my God,
for 20 years.
That's even
so the new nurses quit, or the old nurses quit, and then went to go get rehired. But then you also lose your seniority.
Exactly.
Night shift and weekends and that kind of
stuff. Yeah, exactly. Yeah, no, I think it's a real problem, and I don't see it. I see it only increasing. So honestly, you're prime time right now. During this, I don't know if you kind of started shifting. You may have started shifting before COVID, but you saw what happened with COVID. I'm sure you got a lot more clients, and I don't think this is going to end anytime soon. It's really unfortunate. So I think, but thank you for what you do. And then honestly, just helping them shift, almost like they can still have their same purpose. It just shifted into potentially a different model. Is that the way you and they kind of like look at it, so to speak?
Yeah. And to me, it's really important that we keep the nurses in the profession, because when you have these nurses 20, 30 years working with one population of patients, like you want to hold on to that expertise. You don't want them working as a barista at Starbucks. No offense, baristas, but I mean, that knowledge is intense. It's incredible.
Yeah, no, I agree. I think that's very important because I had a nurse the other day, and she's funny because that's what she said. If this doesn't work out, I'm just going to go work at Starbucks. And you're like, no, you know what I'm saying? Because it's so much knowledge, so much, you know what I'm saying, that could be channeled potentially just into another avenue. So,
and plus there's like, my one social media manager that I had wanted like more money an hour than nurses make. It's a way easier job. Like we actually had a shooting and a death in our hospital system that like rocked the whole, the nurses, that's a lot to absorb, right? Active shooters, you got patients biting you, family members punching you. Like, it's dangerous. And, if you're making $40 an hour and you could work social media manager for $40 an hour from the beach in Bali, like, it's not really a comparison.
Exactly. I agree. No, I agree. No, thank you. Thank you so much, Catie, for being on the show, kind of explaining what's going on and explaining kind of how you're helping all these nurses. I think it's a great thing that you're doing. And so people can find you at Catie@nursepreneur.com. Like I said, I love the title. It's so fitting. And like for all healthcare, like we don't want you to hold on to your expertise, just rechannel it into something else. Don't give up and go into something completely different unless you just feel like that's your passion. But I 100% agree with what you're saying, Catie. And so last quick question, and then I'll let you go. Do you help just nurses or nurse practitioners, or what about like PAs or I don't know, health, like rad techs, medical assistants, et cetera, et cetera?
Yeah, I guess our name kind of repels other people, but the business basics are the same. And a lot of the businesses that we have, that you don't have to be a nurse to do them. Anybody could join them, and we certainly have PAs and other people working with us. So
yeah, perfect. Okay, well, thank you so much for being on the show and telling us all about what you do and what other healthcare workers, not just nurses, but other healthcare workers can do if they find themselves in that situation.
Thanks for having me.